Objectives. Number 1. To elaborate the sociology of health and illness in the Philippine system. Number 2. Cite an example of health system in the Philippines. Sociology of health and illness. The sociology of health and illness study in the Philippines, where the interaction between the society and health. In part of the sociologists examine how social life impacts morbidity and impacts society. This discipline also looks at health and illness in relation to social institutions such as the family, work, school, religion, and culture, as well as the causes of disease and illness, reason for seeking particular types of care, and patient compliance and non-compliance. So these both represent for the vaccination of health and illness. This discipline also look at health and illness in relation to social institutions, such as the family, work, school, religion, as well as the cause of disease and illness, reason for seeking particular types of care, and patient compliance and non-compliance. So these photos represent vaccination in the Philippines for children. Health or lack of health was one merely attributed to biological or natural condition. Sociologists have demonstrated that the spread of disease is heavily influenced by the socio-economic status of individuals, ethnic tradition or beliefs, and other cultural factors, where medical research might gather statistics on a disease. Sociological perspective of an illness will provide insight on what external factors cause the demographics who contracted the disease to become ill. So this is one of the examples using herbal medicine. The topic in sociology of health and illness required a global approach of analysis because the influence of social factors varies throughout the world. Diseases are examined and compared based on the nutritional medicine, economics, religion, and culture that is specific to each region. For example, HIV and AIDS serve as a common basis of comparison among regions, while extremely problematic in certain areas. In others, it has affected a relatively small percentage of the population. Sociological factors can help to explain why this discrepancy exists. Health system in the Philippines. DOH, or Department of Health. LGU, local government units in the Philippines. Private sector in the Philippines. Center for Health Department, Rural Health Units. Department of Health. Profile. The Department of Health is the principal health agency in the Philippines. It is responsible for ensuring the access to basic public health services to all Filipinos through the vision of quality health care and regulation of providers of health goods and services. Mission and vision. We present DOH mission by 2030 and its vision. Milestone. The significant development event or accomplishment of the Department of Health. So this is the photo represent for the Department of Health for the Republic of the Philippines. Local government is a generic term for the lowest tiers of public administration within a particular sovereign state. This particular usage of the word government refers to the specifically to a level of administration that is both geographically localized and has limited power. An example is the office of municipalities. So this one represents as example of local government unit. Private sector in the Philippines. The private sector is defined as those individuals and organizations providing health services or products that are not owned or directly controlled by the government. Firms are also pushing the development of more IT-based services in the country. MedRoser, for example, and has partnered with Ayala Healthcare. So this is one of the examples of private sector and the Philippines. Center Health Care Department. A center that provides services which are usually the first point of contact with aid. All workers respond to the national definition of healthcare providers. So this is one of the examples for Central Health Department, Global Health Diagnostic. Rural Health Unit in the Philippines. Rural Health Unit means individuals living in rural areas are different from those urban areas, and rural areas often suffer from lack of access to healthcare. Example for this one is Jejuari Rural Health Unit or Health Center. Do you believe in these penal health superstitions? Well, based on our culture, we almost believe in superstitions. So what are those examples for superstitions for the healthcare in the Filipino people? Number 1. Get rid of hiccup by placing a short thread with saliva on the forehead. Pag-usapan natin ang ibang paniwala tungkol sa kalusugan. Alam niyo ba ang tamang sagot? Para hindi mausog ang bata, dapat lawayin sa noo o tiyan. Ang sagot dito, mali. May bakterya ang laway at marumi ito. So karamihan sa mga matatanda, nililalawayan natin ang tiyan ng mga bata at sinasabi nitong pwera usog. Number 2. Magkakasipon ng bata kapag inilabas ng bahay nang lampas alas 5 ng hapon dahil sa hamog. Ang sagot dito, mali. Wala namang virus sa hamog. Ang virus ay nakakahawa. Number 4. Gamot ang unang ihi sa umaga para sa puwisin ng kamay o paa. Sagot, mali. Marami po ang ihi. I-flush ito sa kubeta. Patakan ng breast milk on sore eyes para gumaling. Sagot, mali. Gumamit ng antibiotic eye drops para sa sore